Good morning, students. Today we shall learn about what is cardiogenic shock. Now, cardiogenic shock is an emergency condition, rather called as a life-threatening condition, wherein the heart is not able to pump effectively so that the body does not receive adequate amount of blood in order to perform its needs. So how do we define it? So cardiogenic shock is a life-threatening condition in which the heart suddenly cannot pump enough blood to meet the body's needs. Now, why would this happen? This could occur because the patient's heart may be weak. It could also be because the patient has had a severe, massive heart attack, meaning the death of the tissue, and eventually the tissues are not able to perform effectively, eventually leading to lack of contractility and resulting in decreased cardiac output. But it is also said that not every person who's had a heart attack will always end up with a cardiogenic shock. Now, also, there can be various factors that is contributing to this kind of condition. It could be heart disorders or heart diseases. It could be people or individuals who've had massive myocardial infarction. In common terms, it's called as massive heart attack. It could also be because the muscles are weak. It could also be because the muscles are thickened or hardened, or there is scarring, and eventually then what happens is there is not going to be effective pumping action of the muscle. The other kind of factors contributing to this particular condition will include any sort of infection or inflammation to the heart muscle. So it can affect any layers. So it could be the pericarditis, myocarditis, or the endocarditis. And as I mentioned, it could also be because your heart muscle is weak. And all other comorbidities may also contribute to this disease condition, and it could also be because of drug overdose, or even a person is on some kind of medications for a long term, and eventually this can put a lot of pressure on the heart, and eventually the heart muscle will not be. Now, what happens with this condition? So, means we can expect the most common signs of this would be the person's will be experiencing chest pain, chest discomfort, or a chest pressure. That could be nothing but associated with a myocardial infarction. And when we tell about myocardial infarction, we know that the heart muscle is actually demanding a lot of oxygen supply. So when it is not getting enough of it, so there is a lot of demand. So that is when, and at the same time, when the muscle is not getting that adequate amount of circulation due to some sort of blockage or thrombus formation or a clot formation, any sort of etiological factors associated with this, the myocardium can be in a lot of danger. So with that, what happens, the heart will not be able to pump effectively, leading to left ventricular failure, or other called as the pump failure. And due to this, there's definitely going to be decreased cardiac output. And why decreased cardiac output? Because whatever volume of blood that is pumped out of the ventricle, it is going to be very, very low volume. So that means the end diastolic volume, again, it is going to be very, very low. Now, when there is a decreased cardiac output, means even there will be decreased tissue perfusion, means even none of the body parts are going to be receiving that adequate amount of circulation or blood, and eventually the person is going to be experiencing all the signs and symptoms. So definitely there's going to be a decreased tissue perfusion. There's going to be decreased increased systemic vascular resistance. There's going to be low blood pressure, and definitely this is all because of the decreased cardiac. This is another detailed picture which is showing you about what happens during this condition when the heart is in this kind of when the heart is experiencing this kind of condition, or a situation where it is not able to pump effectively. Maybe mostly it is nothing but your myocardial dysfunction. So just kindly go through the main clinical manifestations or signs and symptoms the patients will experience due to this. So definitely there's going to be shortness of breath, fatigue, weakness, fainting spells, definitely low blood pressure, profuse sweating, pale skin, cold hands and feet, loss of consciousness, a very weak pulse, and also sometimes what happens is there can be sudden increase in the heart rate as well. So the patient can go tachycardic as well, and even the breathing can be quite rapid. Also, when you see the urine output, it can be usually less than normal, or sometimes there can be no output at all. So all these are some of the major signs when a patient is experiencing this kind of condition called as cardiogenic shock. Now, this is thing, the symptoms of a heart attack. Now, as I told you, maybe when the patient is having a massive heart attack, also it can lead to this condition. So, this has already been explained to you regarding what are the signs. So, what are the risk factors and complications to this? So, as I mentioned, gender, age is one of the most important risk factors. Also, it can be past history of heart disease, past history of coronary artery disease, and comorbidities, as I mentioned, if the patient is diabetic, as well as having high blood pressure conditions as well. So, the most important complication with this cardiogenic shock is, yes, it can lead to death, and it can also, that is the ultimate complication. But again, due to this particular condition, as most of your organs can be affected, so the major organs of the body are going to be affected, because definitely there is going to be decreased cardiac output, and the body is not receiving that adequate amount of circulation, wherein the organs are not in a position to function effectively. So, there is going to be severe damage to your liver, the kidneys, and also because the organs lack oxygen and are not getting that adequate amount of circulation. How do we diagnose this particular condition? So, definitely a history collection and a thorough physical examination has to be done in detail, and also followed by an electrocardiogram, an echocardiogram. Need be, the patient will also be told or advised to get a chest x-ray done. Definitely the blood test is going to be done, because we need to rule out any sort of infections and any kind of inflammation associated with the heart. And also very important, you need to assess the blood gas levels, because that's very important, because you need to measure the amount of oxygen content in the blood. Echocardiogram, again, it gives us in detail about the contractility function of the heart, and to rule it out best, the best procedure to be done is a cardiac catheterization angiogram, and this will actually show us the exact pumping function or pumping action of the heart, and this will also allow us to measure the amount of volume of blood that is actually ejected when the ventricle contracts. With all this, I think the cardiologists or the interventionists will be at a conclusion if the patient is having this condition called as cardiogenic shock, and how well it can be treated. So, it is definitely an emergency condition or a life-threatening situation, and it has to be attended to very, very quickly. And again, we need to ensure that all the major equipments and support machines are available, and it is in a very good working condition. So, a ventilator has to be available and ready to go, and also the emergency department team and the nurses' responsibility will also be, the nurses are going to be full-fledged in attending to the emergency needs of the patient. They need to be in a position to think and also assess the needs. Should be in a position where they can cannulate the patient and put an IV line which is working very well, because definitely the person may need a lot of fluids. Also, the patient is going to be on vasopressors, which are nothing but it helps to treat low blood pressure. And also you may have to pump in a lot of fluids and plasma, because again, as it is there is decreased cardiac output, so we need to increase the volume. Inotropic agents are also going to be administered, because this will help in the pumping action of the heart, or rather the pumping function of the heart. The patient may also be on aspirin, because this is something like a blood thinning, so it reduces the blood clotting. And why this occurs why this happens, I've already explained to you when I'm doing the previous heart conditions. Since there is no effective pumping, most of the blood will remain in the chamber, and this can eventually lead to clots, and that is a very dangerous condition, because again, at some point of time when that gets ejected, then it can go to any portion of the body and again block the blood vessels. Antiplatelet medication, again, it's very important, because you need to ensure that there's not going to be any sort of clot forming, and even if it is there, it has to get dissolved. And definitely the patient is going to be on medications such as heparin, which is going to keep the blood thin. And again, we need to keep measuring or how thin the blood is, and ensure that the blood tests are done aptly. What are the other procedures or the ways of managing this particular condition? Again, medical procedures to treat cardiogenic shock will include, you can check it out by doing angioplasty and stenting, because again, it could be the main reason when we say that is why the muscle is not able to pump effectively. Again, it could be due to the various heart conditions, as I said. So we need to rule out those heart problems, and then eventually the heart's pumping action, along with, because the patient is definitely going to be on a set of medications which is going to improve the muscle contractility function, so that will also improve. Again, the individual may also patient may also will need a balloon pump. I hope you remember which I have told you regarding IABP, intra-aortic balloon pump, which I have already showed you in the previous session. So this balloon pump machine also will be needed, because that is going to be supporting the heart to pump effectively. And last but not the least, when things are really going wrong, then the patient may need extracorporeal membrane oxygenation, and this is like a support device which is going to take care of the blood flow as well as the oxygen to the body. So that is nothing but the heart-lung machine, and that the main idea is the heart is demanding that oxygen. So we need to ensure that that oxygen is restored, and also all the excess of carbon dioxide is actually removed from the body to ensure that the tissues are functioning effectively. The other kind of surgeries may also include maybe sometimes coronary artery bypass graft, bypass surgery. Again, it is nothing but it is to take care of the blood vessels and ensure that the heart, the circulation of the heart is actually restored. And ventricular assist device, again, it can be implanted or attached to the abdomen of the patient, and this is nothing like a pump. So it will be an external device which is helping the heart pump effectively. So in all stages of this heart failure conditions, the patient may be having a VAD or a ventricular assist device, and if none of these measures are successful, then the only resort for the patient is having a heart transplant. And again, that is not a simple procedure, because you need to ensure how compatible it is. You need to get the right the donor, and also everything has to match and compatible. So it is going to be a long procedure to plan and process and also go ahead with, and the family also needs a lot of education and knowledge to be instilled by the team, and ensure that they are thoroughly prepared both financially and emotionally. So many factors play in this, and it's not an easy procedure to be decided or go ahead with as easy as possible. So most of the time, so with this kind of condition, if it is attended to immediately and quickly, yes, the complications can be reverted and avoided, and the patient has to be the procedure goes successfully. He's definitely going to be on a whole lot of medications which are also going to help the heart to perform its function effectively. Now, the nursing management or the nursing diagnosis in this condition, definitely you know that now there's decreased cardiac output. So obviously now the impaired breathing pattern, that's going to be a problem, because patient is definitely going to be experiencing breathing difficulty, or impaired gas exchange, decreased cardiac output, activity intolerance. Again, there could also be risks associated with a particular condition, imbalanced nutritional status, decreased cardiac output. And output, and I said everything, the nurse looking after the patient should ensure that the patient is having adequate output. As I told you, even the urine output can also be very less and very sometimes very minimal, so it has to be looked into. Anxiety is one of the main important diagnoses, and last but not the least will be deficient knowledge. And again, that would be related to a whole lot of things, like you have to be explaining to the patient and the family regarding his present condition, and different methods and procedures, or the management methods, how we can improvise the condition. And it also will be along with that, the patient's medical management also has to be supported and managed well, because again the patient is going to be on medications. And also what happens is the patient family and the patient has to be educated well enough to know how he's going to, what are the importance of each medication, so that he does not miss. And in case if he misses a dose, it's very important the nurse also educates and advises what he needs to do. And importantly, the diet, the physical activity, lifestyle changes, all this has to be emphasized and ensure that the patient moves into a new phase of life. And very importantly, coming back for the follow-up sessions, it's very important. So important, again, preventive aspects. So your health education will definitely include all this. You'll be emphasizing more on your don'ts, like do not smoke or alcohol, in case if he's a smoker or an alcoholic, or in case into any kind of illegal drugs, or if he's a very obese person, then again you have to insist on how he keeps his body weight down. Invest a lot of time again back to his physical activities. The diet, again, very important to ensure that no fried foods, and because of the cholesterol levels, and reducing the saturated fats, use of less salt in case if he's a hypertensive patient, and sugars, again, cut it down if he's a diabetic. And overall, I think keep everything to a minimal. And also very important to tell him about how he exercises regularly, takes his medications on time, has the meals on time, have small portions of meals rather than big meals, and keep eating every 2 hours, short meals, snacks, and the healthy diet. Follow a balanced diet, get enough of sleep, and also come back for the follow-up and ensure that he gets his bloods tested and investigated, ensure that the medications are working, because the patient is definitely going to be on blood thinners and anticoagulants. So we need to ensure that it's working fine, or the dose of the medications need to be readjusted. Everything has to be done thoroughly and ensures that he sticks to his follow-up appointments. So we finish this little topic, that is cardiogenic shock. Thank you for your time.